A lot has happened throughout the day, but we want to thank God who has kept us alive up to this time. Yes, I know some of you who are already home. Welcome back. It has been an evening with a downpour, but yeah, we thank God. It has been a while and a very interesting moment when we see the downpour. But I welcome you to the Family Hour. This is the Tuesday edition where we discuss family health. My name is Edrin Austin Mukalazi. It's a pleasure having you tuned in at this time. Now, today we are looking at a very, very pertinent issue. At one time, someone said that if you can't smile, then you are partially alive, because you realize that most of the things we do are done by the mouth. Now, when your mouth is not healthy, then there is a lot of danger to you. If you can't talk to your friends, if you can't smile, or if you have to cover your mouth as you're talking to them, if people have to cover their nose as you're speaking to them, then there is a very big problem. But also, if you really have to go through a lot of pain every now and then, surviving on antibiotics and painkillers simply because you have issues inside your mouth, then there is a very big problem. Now, it's a pleasure to discuss dental health this evening. I believe by the time we end this show, your life will be empowered. Remember, this is the Family Hour, empowering families one episode at a time. There are very many dental health issues ranging from tooth decay, pain, tooth loss, early childhood decays, bleeding gums, and a lot of things that we are going to discuss today. We are glad to have someone who is the director of RAN Foundation. Now, when you talk about RAN Foundation is an NGO that is committed to providing essential medical aid to the less privileged population in Uganda. That is why we are looking at making dental health affordable and accessible in Uganda. With us is Dr. Rushaju. Doctor, it's a pleasure having you this evening.
Thank you so much, Adrian. Yes.
Kindly greet the viewers so watching you this evening.
Yeah, good evening, viewers. Greet you in the name of Jesus Christ. And praise God.
Amen. How is RAN Foundation, if we can start it from there?
So RAN Foundation is fine. RAN Foundation started in 2005 as RAN Dental. And RAN comes from the word reaching and reached needs in dentistry.
So I thought it is taking off.
So it was reaching and reached, because when I completed my studies, I started going to northern Uganda in around 2004, 2005. And people were internally displaced people's camps at that time. We realized there was a lot of need. People were not able to access dental care because of the situation. So we used to go there to do dental outreaches. And so we realized a lot of need, and therefore coming up with that NGO reaching and reached dental needs. So RAN Foundation to be able to respond to some of those needs that we were seeing at that time. And since then we've been able to move around the country, almost every village, every community, giving relief dental care. But other than that, we also have clinics here at London Chambers, and also at Akamwes Shopping Mall, and also in Bamba we have a children's community clinic. So all these are geared at offering care and improving oral health care for many people.
Indeed, when you talk about oral health care, then there are a lot of issues, and because very many people are desperate, they have not been exposed to a lot of knowledge about oral health. They have been misguided. You find people on streets selling one syrup that cures almost 7 diseases, including teeth. And you know, this is so alarming. Very many people are really having a lot of miscommunication, and they have a lot of wrong information about dental health. Now, if we start it from dental care itself, because I see when we see that, then we know we are going to be taken through how to brush, and these are all dental practices. But we start from the dental care and some of the things that put our teeth on risk.
Yeah, really to begin with, there are about two major dental problems, two main problems that affect very many people. In Uganda, about 80% of the people are affected by dental disease. Now, the tooth decay really comes about when people eat food and leave that food in the mouth. In the mouth, we have microorganisms. These microorganisms are supposed to be there. They are called normal flora. They're not bad. They're supposed to be there. But when you feed them, especially on these fermentable sugars, then they will break down those sugars and produce lactic acid. And this acid will begin to dissolve the minerals in your tooth, mainly calcium. So if you look at, if we can get, we can maybe look at a wall. If you start removing bricks, then what will remain eventually, one brick at a time, eventually it will crumble. You remain with the cement. And so when this acid dissolves the calcium ions, what remains are the phosphate substances, which are not able to hold. So you get a cavity, you get a hole. So even when you get these substances on the market, they may reduce pain, they may have painkillers in themselves, but they may not restore this broken down structure of the tooth. And so you have very many people, they will suppress the pain, but the tooth will continue to break down. And quite often they will come and they say, oh, my teeth are breaking, you know. So it continues to disintegrate, even when you may not have pain. And so that's a big challenge. Of course, this is a scientific process that we understand very well. And we can, if you visit a dentist, can be able to reverse it, especially when you go early, than using some of these products on the market. Of course, the other challenge is gum disease. That's also one of the main problems that we have, where people will, as they brush, they will experience blood on the toothbrush, or if they're chewing something like sugar cane, and blood comes on that sugar cane. And so most of these problems are, of course, coming from poor oral hygiene. Because if you leave food, like I've said, it will bring problems to yourself. And so we encourage people to brush 2 times a day. Brush in the morning, brush in the afternoon. Of course, if it was possible, even brushing after lunch, that would be okay. But sometimes it's not possible. It's not practical. But we encourage
to tell us to brush
every after meal. Yes, if it is possible. But sometimes, I mean, you've left home, you've gone to work. It may not be possible. But what we encourage is brush every 2 times. So in the morning and then in the evening. It's so important to brush at night, because at night, you know, this saliva is not flowing, you're not interrupting it, the bacteria, like you're doing during the day. Because as you talk, as you eat, as you're chewing, you're disrupting it from doing its work. But at night, the bacteria has like ample time to just make these sugars, to break them down and produce acid. And so we encourage people to make sure never go to bed without brushing. So if you're able to brush your teeth before you go to bed, you brush your teeth after your breakfast. You may rinse after lunch, or have some of these things that can refresh your mouth. You'll be able to keep this disease away. And so that's the advice that we give. Yes.
Now, you've talked about brushing, but it is also possible that some people brush and they're so much committed to brushing, but they don't know the right way of brushing. If maybe we can first of all go through that, and then someone can know, because someone will still say, I brush in the night, I brush every after meal, but the symptoms persist.
Well, of course, I came with this model for me to be able maybe to demonstrate. When we talk of brushing, it's important to know how to brush well. First of all, we encourage that, if possible, do not put toothpaste at first on the toothbrush. Do not put toothpaste. First remove food. First brush without toothpaste. So put your brush on your teeth at a certain angle. I don't know if you're able to see that. Put it at a certain angle, and then the upper teeth you brush, making these turns 45 degrees going down, so that you're able to clean all the teeth up going down, and then down you also put it at an angle, and then you brush going up. Okay, now you are allowed to brush on top of the teeth like this, but not in the sides. Many people make a mistake. You find they're just brushing like this, and that kind of brushing, horizontal brushing or brushing the sides, sometimes irritate their gums. Over time, you may find that it is actually causing the gums to run away from the teeth. And so it is important that you are systematic. You move from one side to another, brushing all the way down for the upper teeth and going up for the lower teeth. Once you've cleaned, of course, all the teeth, the food is not you no longer feel the food on your teeth. Even you put your tongue, you brush your tongue, because bad bacteria also lives on the tongue, and people who smell, what we call halitosis, that bacteria, many people will brush the teeth and leave the tongue, and so you need to clean your tongue as well. So you wash, you make sure that food is not on the teeth, and then you put your toothpaste. You wash your brush, and then the second time you repeat the same procedure. Now with toothpaste.
Okay. Oh, the first time
it was there's nothing.
Now you have toothpaste.
Now you have toothpaste, because the first time you're removing food off the teeth.
Yes.
Okay. You're removing what we call plaque. So plaque is that biofilm that bacteria makes. It's like whitish, like posho on the teeth. So when you just brush with that, sometimes you will not succeed, or you may not achieve what you want to achieve. And so the second time now you use your toothpaste, and this toothpaste is supposed to, in a chemical reaction, the fluoride ions in the toothpaste are supposed to now enter the tooth in a chemical reaction. Are we together?
Yes.
So when you brush now with toothpaste, we encourage you to spit as much as possible, but don't put water to wash the toothpaste off. I usually make fun and say it's just like if you wash your face in the morning, put Vaseline, supposed to protect your skin, and then you wash it away again, then you walk. Or the men who polish, you polish your shoes, and then you wash it again and walk. So this toothpaste is really supposed to now protect or reinforce, what we call remineralize the tooth. So if you wash it away before it has actually worked, then you're wasting it, and many people make that mistake. Of course, many will say it's not comfortable, it doesn't maybe have a nice taste in the mouth, but we encourage you to spit as much as you can. You can rinse, but maybe much later, not immediately, because when you wash it away, then you are wasting it. So we believe that when you leave it there, it is the fluoride ions will now get into the tooth. Remember at the start I told you the acid will be removing calcium ions. So now this fluoride ion will now come to replace those lost calcium ions. So it means if you're doing a proper job, even when you have these acids that are removing the calcium ions out of your tooth, by doing proper brushing and doing, and of course having a good toothpaste, and so doing the proper job, then you are able to replace the lost calcium ions. So the tooth can be remineralized. Even when maybe you took something that maybe you forgot to brush, and by morning there's some calcium ions lost, by doing a proper job, you can actually remineralize the tooth. And that is the proper way of ensuring that you're actually doing a good job. So the problem we have is people will do this quickly, rushing.
Yeah, there is no time.
There's no time, and that's understandable. And so in doing that, they may cause attrition of the teeth. They may cause other problems because of just brushing haphazardly. But you've got to be systematic. You've got to be orderly. You brush without toothpaste first. Brush the upper teeth, brush the lower teeth, brush your tongue. Then the second time, put toothpaste, and then don't immediately remove it. Leave it there so that it can reinforce your teeth. Once you do this practice, and you're doing it all the time, there could be other factors, of course, that may affect somebody, because it's a dental disease multifactorial. to have other factors as well. But largely, if one is consistent in doing that, they are most likely going to have good teeth.
Okay.
Yes.
Now you talked about this part. What about the inner side? How is it cleaned?
It's the same way. So if I was brushing here, I would just be doing the same. I would just do the same. I will make sure that I insist on brushing going down. Remember how I'm just doing this for demonstration, to put my brush at a certain angle, and I brush going down. Now the same, I should be able to do the same even inside. Just brush going down for the upper teeth, and the lower teeth I brush going up. Okay, so what you do out is what you do also inside, and then you can brush on top of the teeth. Okay, but not in the sides. That's a big mistake that people make. Then they end up with a lot of challenges. Yeah, so not brushing horizontally on the sides, but going up for the lower teeth, going down for the upper teeth.
Some people are told that their teeth is supposed to be white, so they as if they are brushing it to be white. So
yeah, well, of course, I know that there are many challenges that people who are maybe born with some teeth discolored, especially a disease we call fluorosis. People who live in mountainous areas, Mount Elgon, Mount Muhabura, and many of these Mount Rwenzori, they may excessive fluoride in water when you're young may cause some discoloration of the teeth. Now that kind of discoloration, you cannot remove it with a toothbrush. However much you brush, you may need to visit the dentist to advise on how they can now whiten the tooth and remove the pigments. Even when you have sometimes actually extrinsic stains, maybe a smoker, and you have those extrinsic stains, they may be difficult for you to remove with hard brushing. And so sometimes it's better to go to a dentist to be able to do scaling and polishing. So there's some kind of cleaning that the dentist is able to do, because we have rotary instruments that help us to do this very well, so that you do not traumatize or cause damage in trying to brush so hard. That would be my advice.
Okay.
Yes.
That is actually very fine. Now, I look at some other category of people that have black coatings or pigments on their teeth. What causes that?
So these coatings, like I've said, you have what we call intrinsic stains, which may be inside the tooth. So when the tooth was developing, if there is any disruption in this process of the development of the tooth, whether by this excessive fluoride, whether by some medications that parents may take, there are some drugs like tetracycline that may cause discoloration of the tooth. But this happens, a parent may take it without knowing, and it may have an impact. So some of those stains may be inside. There are also other challenges, like some hyperplasia, dental hyperplasia, or enamel hyperplasia, dentina hyperplasia. There are some conditions that may also which come about disruption in the process where the tooth is developing. Some of those may appear as teeth are discolored or having, do not have the same color. So that cannot be removed by you trying to clean it off and things like that. You need a doctor to be able to do that. But there are extrinsic stains which come out of negligence. So one, you have when I talk about this gum disease, for example, this plaque that I talked about, which is a whitish substance that forms on the teeth as a coating, a whitish coating. If it is not removed, over time it can harden, it becomes tartar, it becomes, hard, and it can change color. It can move from green to black. Now, some people, you see that, especially right at the margins of the gum, you see some kind of discoloration, and that can be a gum disease that is showing as a plaque, as tartar. Now that needs to be also removed by cleaning and polishing. Now, issues to do with like smokers, so you have stains. these extrinsic stains and other habits. There are people who, depending on what they do, you know, if they're always using the mouth maybe to blow or whatever, there could be other occupational hazards that may cause discoloration of the teeth. So all those stains, whether they are outside or inside the tooth, the dentist still has a capacity to remove them. And so we do not encourage somebody on their own to be fidgeting with the teeth, because you
someone
can cause
gets
trauma.
a needle and they start plucking it.
Yes, yes.
So what causes malalignment?
That's a good question. So malalignment is, I would say, also a number of factors, but largely when children are born, they have a small jaw. So God made it in a way that He gave them 20 teeth, baby teeth. They're smaller. These baby teeth, they actually do the same job like adult teeth. But these baby teeth are supposed to come out. So they come into the mouth at the age of 6 months, and at 6 years, they start getting out. So you start removing them 2 by 2, usually 2 centrals, and then 2. They begin with the lower ones, then the upper, then the 2 laterals, and so they kind of get out in a, they are removed in a pattern. Now, what happens is that when you usually when they get decay, and because sometimes parents may not mind about cleaning the teeth for the children, they may think maybe this is not important, so they get out early. When they get out early, the problems start, because sometimes as the other permanent teeth begin to succeed them, they may come and assume a lot of space, or they take a different space. You know, if it was supposed to be here at the molar, like the molar, which comes at about 6 years as well, together with these ones in front, it may assume a forward position because the other teeth are not there. So these teeth are supposed to be keeping the space for the adult teeth as they come. So they get out in a pattern, and those that remain are keeping space for the adult teeth. So as the jaw expands, because you know the adult teeth are main and bigger, they cannot be accommodated in a small jaw. So as you grow, the adult teeth begin to do what? To come in. So what happens is that if the milk teeth were not looked after very well, and therefore the way the permanent teeth are coming in, they will begin to assume positions which are not theirs. By the time the canines come, mainly the crowding of the front teeth, and largely these canines, when they come much later, maybe 11, 12 years, by the time they come into the mouth, there is no space for them. So they appear to be on top of the others. So you have that kind of disorganization. Of course, that is just one factor. There could be others where somebody has a small jaw and then big teeth. The teeth are bigger than the jaw. At times when the jaw maybe stops growing somewhere. So the crowding and the way the teeth will appear can be also caused by a number of factors. But largely, that is not looking after the baby teeth, milk teeth. Not taking the kid to the dentist to be able to check and advise, and you know, that largely contributes to malalignment.
Okay.
Yes.
And I cannot, of course, leave this without asking you about infant oral mutilation, because this is a very common factor, and when it shows up, very many parents panic. Now, this is commonly called okukutebinyo. So children are taken for that. I don't know how harmful it is, but I don't think it is healthy for the child's teeth. Yes. What causes that, and how can it be handled in case it shows up in a child?
Yes. So oral infant mutilation is a term that has been given to talk about false teeth removal, or ebinyo. And this is a practice that is, you know, found here in the poor countries. You will never find it in the developed countries. But the whole point is that what happens as the milk teeth or the baby teeth are coming out into the mouth, they come out in a process we call eruption. So they come with a force into the teeth, into the mouth, and that force sometimes overtakes the child's ability. So like maybe we can talk of a pimple. You have a pimple, it brings a fever, you know. So when this development of this tooth that is coming into the mouth, sometimes it may bulge in areas of the canines, And so people think that these are actually false teeth. Now they rush these to people who use a bicycle spoke and pierce them. Of course, usually what happens is that you have this fragile tooth that has not been calcified, and they think because it is worm, it is a worm, or they say it is something else. But actually, it is the actual tooth that was developing. Because in most communities where they are doing that practice, when they remove that so-called false tooth, nothing will happen after. They will not get a permanent tooth. Most of them remain without, because they damage the tooth, the actual tooth bud that is coming and going to form your permanent tooth. So if you're lucky, some of them, they scoop out that baby tooth and then leave the permanent tooth under, and so that one may develop. But there are those communities where they scoop everything out. So they are trying to do that because I've interacted with quite a number of them in our engagements in the community, and they tell you the child, a kid will die if you don't remove them. But when you are to analyze, you find that kids die out of high temperatures that are not controlled, and diarrhea, because of pain they keep touching there with dirty hands, and that may cause diarrhea. And so not controlling some of these could be the cause of death of these children, but not that the tooth itself is the one who is going to kill the child. And others have said, well, the teeth have come so early. But you know, we are not bothered so much that this child has developed teeth early, because these teeth develop when the baby is still in the mother's womb. Teeth are already formed there, waiting to just come out. And so it's something that we shouldn't worry about. When a kid tends to bring the teeth early, and maybe they are also causing that fever or causing disruptions, they're supposed to be taken to health facility to manage these symptoms, to manage the diarrhea, manage the fever, but do not tamper with the teeth. The challenge is that because they go to the traditional people, for them they use now to piercing and getting this tooth out. Of course, it causes trauma. And there are some studies which say that excessive trauma at that time, because they don't use anesthesia, may have an impact on their brains. But also others have said they may not use sterile equipment. Some of these things are not sterile, and so they cause sepsis, they cause other challenges. There are kids who have died even after doing that kind of procedure because of now the infection they introduce into the child's mouth. And so it's a bad practice that we do not encourage. And we believe that as people seek medical intervention, that should be stopped.
Okay.
Yes.
Now, we are taking a short commercial break. And when we come back, we really want to now derive into discussing the affordability and accessibility of dental health in Uganda. Please stick with us. Welcome back from the break. We are discussing oral health or dental health, and it would be our desire as Ugandans to see that oral dental health is really affordable and accessible. But you realize that because maybe sometimes it is not accessible, that is why some people have embraced the wrong information about dental health, which is really so bad. Now, we are glad that we have Dr. Brian, the director of RAN Foundation. Now, RAN Foundation, like he said earlier, is an NGO which is committed to providing essential medical aid to the less privileged population in Uganda. And when you talk about medical aid, majorly dental health care and dental health education. So it is exactly what we are doing here, and it is very important that you have this information, because if you do not get information from the right person or from the right people, then you will get information from wrong people, and that information might cause you problems. Doctor, before the break, we had actually talked about Evinyo, and someone in studio told me he didn't know Evinyo, and I wonder where he grew up from. This is a common talk, especially here in Uganda. it is a very common talk. But before we get into our next discussion, we have now a talk of the toothbrush. Some people say use a hard brush, others say use a soft brush, and some people don't even know the difference between a hard brush and a soft brush. And then others will say use a wavy toothbrush. Then others say use a straight toothbrush. So which is which? We want to hear it from you. And what is the recommended toothbrush?
Well, that's a good question. Thank you. What we recommend is because people have preferences.
Yes.
And you're not going to force everyone to use one type of brush. But even within your preference, we encourage certain parameters that the brush should have. So a brush should have strong bristles that are going to do a job, that are going to clean. If the bristles are not strong enough, then there's going to be a problem. You may actually not achieve the cleaning you need. But largely, we want a toothbrush to be smaller at the tip or conical at the tip, so that it is able to reach the back teeth. Because when it is broad at the tip, you're going to have a challenge where it's brushing only these front teeth, and most of the behind teeth will get challenges. So if you can get a brush that is a bit smaller at the tip, the better. Now, the one which is rugged rather than the flat one, the rugged is to help you when you're cleaning, so that some bristles, as some are cleaning on the top of the tooth, others go in between the teeth. So that is the rationale behind the ones which are rugged, the rugged brushes. So the rugged brush may be better than the one which is not rugged. But at the end of the day, a brush should work for you. That when you brush, you feel your teeth are clean. Once you move your tongue, you should feel like your teeth are clean. So it should work for you. And I know that the companies say you should throw them away after 3 months, but really research says if it is working for you, you should be able to continue using it for a little more. The only challenge is, of course, when the bristles begin to bend and it is now causing trauma, it's causing challenges, then you should dispose that toothbrush. And then the way you look after it, make sure that in the cup, you don't put it in the cup facing down. Try to put it up, facing up, so that it drains and it's able to dry properly before you use it the next visit. And also washing it very well. If you look after it, a good toothbrush can take you for some time. And of course, there are people who say, "What about the chewing stick?"
Yes.
The issue is, whereas our people in the past used to use chewing sticks, and people in the villages, I'm just from Karamoja, and for people, they're selling me these chewing sticks to brush. That wouldn't be a bad idea. The challenge is that now with increased sugar consumption and things which are refined sugars, most of these chewing sticks may no longer be effective as they used to be. But also you take more time. If you're using a chewing stick, if you go to clean one tooth at a time, you are not supposed to move a chewing stick like the one we used using a toothbrush. Otherwise, you also cause trauma. So you're supposed to move one tooth and you clean another and you clean another. That can work for people who are just eating fresh foods in the villages and are not exposed to sugar. The biggest challenge is that these days, and why we're having even increased problems, people are now adapting to sugars, adapting to sodas, which was not in our diet before. But in the past, you would easily survive with a chewing stick because you're just eating fresh cassava from the garden, you're eating fresh foods. But now with these fermented sugars in cakes, in bread, in sodas, most of these sugars are sticky. You may need now to invest also. If you can invest in soda, you invest in a toothbrush and toothpaste.
They're almost the same price.
for you to be able to protect your teeth.
Okay.
Yes.
Now getting into the discussion of the affordability and accessibility of dental health in Uganda, you as the director of Rand Foundation and who has been into this, what is your experience, if you can start from there? Do you feel that there is enough has been done, especially with educating people about dental health, or even with the Rand Foundation? Do you think you've done quite a lot to sensitize people and to extend these services closer to them?
Well, thank you so much for that question. What we are doing is extending services where there are no government services. When you look at the structure, the government structure, we have national referral hospitals here in the city. We have regional referral hospitals. We have district hospitals.
General hospitals.
Yes, general hospitals. Then you have Health Center 4, then 3, 2, and then of course one is the VHT. But now we find that dental services may be offered at the national, at the regional, and then district hospitals, and some health center 4s. A number of
dentist comes once a week.
Yeah, it may be.
So if he comes on Thursday, you have challenges on
yes,
Sunday.
that is another challenge. But for deployment, it ends at Health Center 4. So Health Center 3, and when we talk of Health Center 3s, is about 1,200.
Yeah.
You talk of Health Center 2s, they're about 3,000, maybe 500. So all these are in the rural communities, because the deeper you go, you are going to be seeing the Health Center 2, the Health Center 3. Now, that's where the poor people live. But yet, that's the government is not able to put dentists up to that level. So we find that most of these people have got to walk either a long distance to go to the district or the Health Center 4, maybe 20, 30 kilometers away. Now, that poses a challenge, because in Karamoja, in Kabong, where I was, in Ik community, the dentist is at Kabong Hospital. It's about 40 kilometers to this community. They have a health center 2, which is 10 kilometers. So you find that if somebody is to move to, maybe you've gotten a toothache, and you have to spend, because about 40,000 on the border to go to Kabong town from that community, and 40,000 to back, that's about 80,000. Yeah. So you find that alone is a limitation in accessing dental care. And so there is that aspect of accessibility in terms of distance, in terms of the facility being there, and the dentists and the tools that they use. That is one aspect. But the other one, of course, there is also culture, is the limitation of people are used to traditional options. They're used to other things that may help them. And so you find that all these combined, because I was in one community in Moroto, I found a woman who had put a thorn into her tooth in order to numb pain. Had pushed the thorn through up to the apex. Now we find that people will begin to use different things in order to bridge the gap. So our efforts are geared at meeting some of those challenges communities where they do not access. It could be geographical, it could be any other reason. And so when we go for these outreaches in partnership with different organizations, we try to bridge that gap. But we are coming up with a bigger plan where we are starting a school, a dental school. It's Galilee Health Institute. This institute is geared at making partnerships with communities that do not have dental services, bring somebody from such a community, train them, a dental therapy course for about 3 years, equip them, give them the basic, a small dental chair, give them the tools they need, and then they go back to the community that gave them to us. We believe that is going to be better in addressing this challenge than us moving all over the country, because definitely there is a limitation. And so if we're able to do partnerships with local communities that do not have dentists, whether they are churches or they are will have different partnerships, then they can give us people to train who will go back and serve their people. Because, you know, when you look at the dynamics of dentistry, of dental care in Uganda, you find that in about 1972, the Danish government put up a dental school in Monaco to train dental assistants. And the aim was really to teach the community about dental health, do emergency treatment, simple fillings and things like that. But because of, it could be a number of factors, now most of these people do not go to the community, they stay in the city. Of course, later on, Makerere started also a bachelor's program. Other universities have come on board, started other program. But after that heavy investment of training somebody for 6 years, training somebody on gadgets that will need electricity, they are not comfortable going to these rural communities to waste their talent or waste their gift. And so you find that the majority of the people will actually stay in urban towns. That's why when you look at the statistics, you find that about 70% of the dentists will be in town, versus versus the ones who may opt to go to the rural areas. So there is that challenge, and that leaves the other people not served. And you don't blame these people because they have made an investment, they have studied, they have taken out of their pocket, they've got to recoup that investment. So that's why we would want to train people for a short time, but train them when they have come from a community. We send them back to these communities to serve their own people. Of course, the issue also culture. You've got to look at things like that. You send somebody and he's going to talk about a vinyo, and he has experienced the vinyo himself, or he actually knows the practice, he knows the people who do it, and now he's able to go back to their people and be able to communicate to them, than us who you may see us as a stranger and you may not believe what we are saying. And so those are some of the thoughts that we are trying to make sure that we can use to address the issue of lack of accessibility and affordability.
Okay. But have these communities really embraced these services? I look at the communities we've just discussed earlier, because I know communities up to now that still use sticks, as chewing sticks as their toothbrush, and have such communities embraced these services? And like when you try to give them an alternative of a toothbrush, have they really embraced this with positivity, or you still have those limitations?
Yeah, usually when we go to some of these communities and you're carrying these toothbrushes to give for free, we found that, of course, when it gets old, then it's a problem for them to be able to replace them. And actually, it is, you've grown up not doing something. The mindset, it doesn't change just by a mere talk. It's got to be a lot of effort, and that's why we want to have people who can remain in the community, remain talking to these people, remain sensitizing them. Some of these things don't just change, because somebody may actually start using a toothbrush, maybe senior one, when they're going for boarding, and it's a requirement by the school. So you struggle, you keep forgetting because it's not part of you. So really, to say that our visits make a complete change of mind, it may be a lie. But we believe that continued efforts will eventually cause people to realize that brushing is important. And of course, it's better than nothing, because when you're able to go and somebody listens in and is able to know that the cause of this is not because you're not brushing, a number of them may actually pull up their socks.
Okay. Now, the other thing is about which toothpaste to use in communities. You realize that some have even turned to traditional, local, readily available stuff, like people get charcoal, they pound it very well, use that, or some other people use ash, some others have been told to use sand, others use salt, and all that. So how do you advise on such?
Well, of course, we try to discourage most of these other things that are used, because if you're using ash, it has a component, it can help you, but sometimes we get worried. It's not regulated. The reason we usually encourage people to use regulated products is you're able to control the damage it can cause. So whereas ash and maybe charcoal can help, but again it may cause other challenges. So we're saying a chewing stick may be softer, may not be as dirty as the charcoal and the whatever that you are picking and putting things in the mouth. Of course, salt is okay. You can use salt because salt is a preservative. We don't encourage soap. There are those who try to use soap. Soap will affect your gums, may damage your gums. But at least we want, if you cannot access a toothbrush, use a chewing stick. Okay, put some salt and be able to brush. Okay, one tooth at a time. But these other things may actually pose a threat, may cause cracks, may scratch your teeth and worsen the situation. As you're trying to clean, they worsen the situation because the tooth is supposed to be smooth. If you scratch it by using sand and all these hard things, it can be a problem because if it becomes rough, it will attract other dirty things to attach. So you may actually complicate your situation. So use a chewing stick. That should be able to work for some of these communities. When it comes to toothpaste, it's a very big question because we have a lot of cheap toothpaste on the market, and unfortunately most of this cheap toothpaste may not have all the ingredients that you need to help you, because what we need in a toothpaste is fluoride mainly. It has abrasives which help in cleaning, but what you want is fluoride, like I told you at the beginning, to reinforce your teeth. Now most of the ingredients that you're supposed to look out is sodium fluoride as the main ingredient in the toothpaste. There are many toothpastes that are using the technology of sodium monofluorophosphate, but what the research tells us is that this monofluorophosphate binds the fluoride, and the fluoride may not easily be available, may not be free when it touches, when it mixes with saliva to enter your teeth. And so it will be there, but is not freely available. So you find that a toothpaste which has sodium fluoride as its main ingredient, the sodium ion, the fluoride ion will dissociate quickly to enter your teeth. So people will have to be able, because I can't be here marketing one product to another, but people have got to be careful to be able to just read that, because that's an advice I can give from a point that I know that these have been put to a test, and the one which has sodium fluoride will be able to help you than the one with sodium monofluorophosphate.
Okay.
Yeah, thank you.
Now, we can't, of course, leave this without talking about two important issues. One, what happens if someone brushes and their gum bleeds? Is there any first aid, or is it a danger sign that is indicating something dangerous to your teeth? And if it happens like that, what is there anything they can do at home? One, as first aid before maybe they can access the dental services in a clinic.
Yeah, thank you. So bleeding gums is actually that initial symptom that may tell you that there is a problem with your gums. Okay, and the whole point, what we said, if you leave food on the teeth, the food starts to harden. So it first forms plaque, and then that plaque can harden. And as it hardens, of course, it is going to be, it has a lot of microorganisms in it. These microorganisms will sometimes cause an inflammatory process on the gums. So the gums start, can say maybe being weak, and that, as they start to bleed, as they start to give way, they start to bleed. At that initial point, we encourage you to use warm water with salt. But visit the dentist to be able to remove all the irritants, all the plaque, all the things that are causing that to happen. Because if you do not, then that may continue to break down the system that supports the tooth, what you call the periodontal system. So that system, which has the fibers, the things that are holding the tooth, will continue to break. And you get what we call periodontitis. Of course, it comes from that gingivitis, which is the inflammation of the gums, but it can now progress. So at that initial, what we are saying, first aid, yes, could be warm water with salt at home, but that is not the end, because the bleeding may stop temporarily, but that may not, the irritants, If they are still there, they definitely is going to come back. So it will be good to go for that cleaning, professional cleaning at a dentist clinic, so that they can be able to remove them. Once they are removed and the tooth is smooth, that problem can go away, because gingivitis or that bleeding is not as bad as what will come after if we do not intervene to get periodontitis and other things that are reversible.
Okay.
That gum disease is reversible.
Okay.
Yes.
And lastly, how many communities have you so far reached as RUN Foundation?
So we have visited almost all districts in Uganda.
Okay.
Apart from the ones maybe created recently or something, because we are not going to.
I believe they are not districts.
Yes, since 2005, some of the districts in the north were not safe. But as soon as it became safe, we were able to visit all these places. So we've largely visited almost every district. It's hardly any district we've not visited. And the whole point is that definitely all our efforts cannot reach everyone, and we cannot go to every sale, and that's why now our attention is going towards equipping now other young people to continue this kind of work. So we want to be able to get people from these communities that are struggling, train them, send them back. But we still, that is not to say that we are going to cut off or to stop our engagements with the communities. We are still visiting communities and still interested in these rural communities. If you're in a community that where you don't have a dentist, you don't have dental services, you can reach out to us and we'll be able to come and visit and help the people and do some dental work.
So in all these dental outreaches, do people pay to benefit from the service, or it is charity?
Yeah, it is free. It's free of charge.
Okay.
People do not pay. We usually do partnerships with other organizations that sometimes raise the support to be able to help the people.
Okay.
Yes.
Doctor, what are your parting shots as per dental health care, dental health education, and this whole discussion that we've had?
So, all viewers, it is important that you look after your teeth very well, like we have talked about. Brushing 2 times a day is so important for you to keep your teeth. 2, visiting the dentist. You need to be able to visit the dentist. It is suggested that at least every 6 months you go and visit the dentist. But even if you can't afford visiting a dentist 6 months, at least once a year. Don't go past a year without visiting a dentist, because a dentist will be able to identify problems early enough and intervene early enough. Because if you're to maybe make a simple dental filling, may cost you about maybe 50,000, maybe 100,000, than waiting and the tooth breaks down and now you're in pain and you need to do a root canal of 500,000. So you find that you complicate the situation for yourself. So visiting a dentist early, having early interventions and early advice, because sometimes if you're doing something wrong, then you have an opportunity for the dentist maybe to teach you on what you need to do. So if one is able to do that, you're able to prevent, because they say prevention is better than cure. Yeah, thank you.
Thank you so much, Doctor. We are indeed blessed to have you this evening, and I believe this message has landed to the right people out there. And to you, our viewer, thank you so much for watching from where we started up to now. This is Family Hour. Tomorrow is Family Wealth and Finances. You don't need to miss the episode, but we shall have Soul Moment as we sign out, and tomorrow there is Good Morning Family early in the morning. Also remember to be part of our lunch hour fellowships every day, Monday to Friday from 2 p.m. to 3 p.m. God bless you. I've worked with Brinko Ategeka on camera, Jonah Jao the producer, and Didmas in transmission. God bless you and good night.